Good evening, Bahamas. Coming up tonight, over 400 Bahamians stranded abroad registered to come home. A national blood drive to fill a need at PMH. Plus, the touching story of a mother on the brink of giving up.
Our news is brought to you by Alive.
Welcome to Our News and thank you for joining us. I'm Kyle Joaquin. Over 400 Bahamians stuck abroad have registered to come home, according to Bahamas Consul General to Miami, Linda Trico-Mackey. She said since the Prime Minister's announcement on Monday inviting Bahamians who wish to return home during the emergency measures to contact the consulate office, she has been inundated with calls from all over the U.S. Mackey said 400 Bahamians have registered within Florida alone, but it must be prepared to show proof that they really are stuck.
The persons here are required to be tested for the COVID-19. The government has taken full responsibility for a person being tested so that no one travels who's positive to protect all persons concerned. They all have to show proof that they are truly stranded and are here because of the shutdown. So they have to show a proof of a ticket that was purchased and no longer were able to use it.
Once Bahamians return home, they will be placed in a government-monitored quarantine facility for 2 weeks. Now, as the emergency measures have been extended to the end of May, Mackey said that doesn't necessarily mean those Bahamians will have to wait until then to come home. In fact, she's hoping by Mother's Day.
Let's just say I'm hoping that it happens next weekend, but that's not confirmed. Hoping that it's next weekend. But we're still waiting Foreign Affairs to give us all the specifics with that. But that's my desire.
Though the number of Bahamians eager to return home is expected to increase in the coming days, Mackey couldn't speak to whether there is a limit on how many the government is able to accommodate. She said it all hinges on what airlines decide to do.
My bigger concern right now is how the airline is actually going to handle transporting them, because now airlines are changing their policies where some of them are not allowing persons to sit in the middle seat. So I'm not sure if whichever airline we use, if they're going to adopt the same policy, which means that less persons will be able to travel per aircraft. And we're not even sure how many aircrafts will actually come.
In an effort to collect its goal of at least 100 units of blood, Princess Margaret Hospital launched a national blood drive today at Thomas A. Robertson National Stadium. Giorgio Bain has more.
Amid the COVID-19 pandemic, residents were asked to join the national blood drive here at the National Stadium. But before you can go in, there's a manual test that you have to do.
All right, good morning. Any cough, shortness of breath, runny nose?
No, ma'am.
97.5, you're good to go.
Thank you.
There were no long lines or crowded rooms at the National Stadium on Wednesday as organizers arranged those who signed up to donate into different time slots. After having their temperature taken on the outside, donors registered at the front desk and then sat in the waiting area until their names were called. After that, they moved to a third table for screening, and then it was off to the collection bed to have their blood taken. Our News spoke with Edward Cunningham as he was having his blood drawn. He said the process went smoothly.
I think it's a good gesture and helping those who are in need, to help save lives. It's not painful if you don't pay attention to what they're doing. It just goes smoothly.
Diane DeCardenas is a regular blood donor, but said she was a little skeptical about going to the hospital to donate after the COVID-19 spread to the Bahamas.
So I'm a little out of breath because I just donated. But, and I was a little nervous, going to one of the hospitals, the blood banks there to donate. So whenever this, this opportunity at the stadium came up, and, I knew that everything would be clean and sanitary.
Universal donor Dr. Michelle Major said it's important to do your part to save lives.
I was very nervous coming in today that, as far as the social distancing, etc., but I was very, very pleased with the process. It was quick. They have adhered to all the protocols, and I think have even exceeded the protocols. And so I'm very comfortable to give blood today.
Supervisor of the blood bank, Dr. Everett Miller, said levels at the nation's blood bank are running extremely low, and he is hopeful that with 80 persons signed up to donate and 10 walk-in donors, the blood bank will be able to help those who are in need.
I think we've gotten about 15 fights so far. Okay, we're expecting about 80 today, and I think we're going to reach that quota because we have people that are coming in and they're committing themselves to continue giving blood.
Health Minister Dr. Dwayne Sands was also on the list of donors and told residents that there is no need to be apprehensive.
You can manage having given 1 pint of blood and carry on your ordinary daily activities. But that single pint of blood can make a difference whether somebody can walk, breathe, get out of the intensive care unit, survive an operation. Our blood banks are running at a precariously low level.
Reporting for our news, I'm Georgie O'Bain.
The World Health Organization will not be receiving its $500 million contribution from the U.S. government as a result of the COVID-19 pandemic, a decision that will affect the Bahamas greatly, according to Health Minister Dr. Dwayne Sands.
Clearly, this is going to have an impact on a number of things potentially. The Pan American Health Organization and WHO are looking at how the funding challenges could impact the biennial program. We get our vaccines through the Pan American Health Organization. There are already challenges with accessing vaccines because of increased costs of shipment.
According to Sands, this could affect the Bahamas' ability to get much needed vaccines.
It is likely that the Bahamian government will have to give in cash or kind to continue the same programs that have been ongoing. But we're committed to getting it done. We don't believe that this is going to last forever. And hopefully, as the discussions go on between the United States and WHO and so on and so forth, this will be resolved.
An independent member of parliament is slamming government's COVID-19 assistance programs. Centerville MP Reese Chippen says he's concerned the plans being put in place do not have the interests of the less fortunate at heart and are a true reflection of those sitting at the table. At this water pump through DeVoe Street, you have to stick your finger in the nozzle to get the water out. It's one of about 15 in the Centerville constituency. And for many years, these residents have had to utilize them as around half of the 2,900 households in this area do not have running water. And as many of them venture to the pumps in search of water to bathe, clean, and in some cases drink, the area's MP Reese Chippen has called for better upkeep of the pumps, from sanitizing to fixing them altogether.
First of all, it's broken, right? So the community is unable to even access the water under normal circumstances, right? If you look here, for example, you would see this is an issue of health concerns. And this is the case with most of the standpipes here in the Centerville constituency.
But Chippen said the water pumps are just a smaller part of a much bigger issue. The Centerville MP hit out at the government's COVID-19 programs like rental assistance, which he says reflects that they were not designed with the poor in mind.
A lot of us are delinquent with our rent, and so we don't qualify right off the bat. So what we were hoping was that this was a real assistance package. We don't want a package with too much percentages here and percentages there. The people want to know that if you are offering assistance, there is payment to show the assistance.
Government's rental assistance program is for those whose employment has been affected by COVID-19 and gives them the option to have landlords defer a portion of the rent for 3 months, which has to be paid in full within 12 months. The Prime Minister also announced on Monday a food distribution program, which he says is being finalized. Chipman said he had hoped the assistance went a bit further, but said he sees that there is a disconnect between the decision makers and those who have to live with the decisions made.
And I don't know if we're not at the table, right? Because if we were at the table, you would see a difference in the approach to offering assistance. We're not asking for somebody to come and take to pay our bills. We're asking you to offer some assistance at this time, seeing that we are unemployed. And it's very challenging right now for us even to find food.
As for the water pumps, we reached out to Works Minister Desmond Bannister, who said there's only one in the constituency that's not functioning, and it has to do with how the people use them. He said every one of the pumps are maintained by someone in the area. Airport closures have left many Family Island residents stuck in New Providence, including evacuees who were displaced following Hurricane Dorian. Grand Key resident Stacy Miller says she is now facing a storm far more devastating than Dorian, and it has left her on the brink of giving up. Jasmine Brown has her story.
The mother of two says she thought being displaced by Hurricane Dorian was one of the lowest points of her life. However, she now says COVID-19 has turned her family's world upside down.
It's not even political for me. FNM, PLP, DNA, the private sector, the organizations, I just feel like everybody should come together and try help who need the help. I need it.
That's 41-year-old Stacy Miller describing just how desperate her situation had become. She says she has had to tune out of the everyday news cycle for the sake of her sanity.
I give up. I'm not watching the news no more. I ain't listening to the radio no more. I just give up. Because every time you turn on the news, it's something.
Miller, who spent her entire life on Grand Key, said she and her two sons, Dejan and Joshua, have been facing a new reality ever since Hurricane Dorian ravaged the northern Bahamas last September. In the immediate aftermath of the storm, she was forced to relocate to New Providence with her two sons, where she had been living in a shelter until she found work as a housekeeper. The Grand Key resident said she had to stay on New Providence so that her sons could go to school. Within a few weeks of working, she was able to move into an apartment and furnish it with the help of the Ministry of Social Services, which she said provided her with her first and last month's rent and security deposit. She also started her own cleaning company and secured jobs at several homes.
Working, and then now COVID-19. I haven't worked for 5 weeks. I had 5 houses. Can't tell you the life I was living. Park one car. We could go to the food store, we could go to the mall, go shopping. But now I have no job and I can't go home.
And it has taken a mental toll, bringing her to some of the lowest points of her life, like crying on her son's birthday because she couldn't afford to buy him a gift. It was also a thought that brought her to tears.
2 months ago, I had to apologize to them. It's because I was frustrated and I take it out upon them. So I had to apologize for that. And then last week, when it was Dejan's birthday. So it's really rough.
Miller says while she often feels hopeless, she has not lost all hope. She says agencies like New Providence Community Center and local families have helped her family survive, and as a result, she has been able to share what she has been given with others in her position. Reporting for our news, I'm Jasmine Brown.
All right, thanks, Jasmine. Still to come, how Cable Bahamas is connecting PMH patients to their families. Stay tuned. Cable Bahamas and Alive have partnered with Princess Margaret Hospital to connect patients with relatives via phone calls and video conferencing. Alive Chief Commercial Officer Garrett Brown says 15 phones will be provided for patients.
In this case, we've simply provided phones to the Public Hospitals Authority, so we provided 15 devices with plans, provided for a period of time for at least 3 months that just allow them to make calls, video calls, regular calls freely with their friends, family, loved ones.
The phones will be dedicated to patients on the children's ward, those in the emergency department, and for updates regarding babies on the neonatal intensive care unit. The donations come as visiting hours at the hospital were suspended to minimize the spread of COVID-19. Brown says Alive and Cable Bahamas understand the importance of family support during the recovery process.
We just thought this was a great way that we could support all of the social distancing efforts throughout the country as a whole. And this is just one of the many ways that we have been providing support to the Public Hospitals Authority, and we continue to do so. We know that connectivity is really important at this time, and so we thought this was a very small thing that we could do to facilitate patient connectivity with their loved ones, because that's so critical as people get better.
Brown added it's just one of the ways the Cable Bahamas Group has been working to introduce technology to different government agencies.
We have a number of programs and app developments and technology deployments that we've been testing and beta testing over the last 2 years and just getting ready to roll out. And so this time is it is unfortunate for the country, but it's also good to know that there are companies and their groups who've been working on these things over the last few years, and this is something that the country as a whole can benefit from.
Each day, the Ministry of Health issues an updated list on confirmed cases. Tonight, Jerome Sawyer takes a look at the team responsible for gathering that information.
This story is brought to you by Executive Printers. We print profits for you.
The data collection team in the Ministry of Health's surveillance unit is the first point of contact for generating all those facts the media and public vigorously pursues. Nurse Janelle Pickering and her co-workers carefully input and analyze all patient data.
We have our daily tracking, we have our list of contacts, we have our list of persons that are hospitalized, we have our family island cases. So we have various stations to make sure that we keep abreast of everything that's happening through contact tracing, through the lab, through any cases that are happening.
She's a part of a medically trained team of Bahamians whose expertise have become crucial in battling the biggest healthcare crisis of a generation.
We may be putting in something and then you see, okay, this either doesn't make sense, or we need to follow back up with that person to say, well, okay, this temperature is high, this person is having a lot more symptoms, we need the physicians to go out and see them, we need them to see exactly what's going on, we may need to now swab that person to see if they now are a case or something else is happening. Because remember, even though COVID is prevalent now, we still have all of the other things that are occurring in our country.
A Bimini woman was one of the earliest COVID-19 related deaths. A community spread on that tiny island now makes it a hotspot. Nurse Ingrid Seymour helps to coordinate Family Island-specific data dedicated solely to slowing the virus spread on the islands.
Indeed, when they have a patient who meets the case definition, they can just go ahead and swab that person. They would then call this office to let us know that the swab has been completed, and we make arrangements for the swab to be taken to the lab.
That initial Bimini case highlighted the fear factor and a need for critical air transportation equipment.
Thankfully, we now have the medical bubble that healthcare providers can use now, so that has alleviated a lot of the fears that is associated with transporting patients.
Reporting for our news, I'm Jerome Sawyer.
All right, thanks, Jerome. Still to come, how Blanco bleach is meeting increased demand for disinfectants. Stay tuned. You're watching Our News. Welcome back. A local chemicals manufacturer is launching a new product to meet new demands brought on by COVID-19. Jared Higgs has more.
It's an opportunity for us to say, you know what, we are here, we've been working for a long time, and we can supply the Bahamas with, their cleaning needs.
Anybody who buys disinfectant products would know that those items are difficult to come by these days. In response to that new demand, Blanco Bleach's sales manager Roman Knowles says the company is launching its newest product, an all-purpose disinfectant spray.
There's a disinfectant spray that you can, is for topical use, any counters, doorknobs, so anything that you would think might have, bacteria, viruses, germs. You can spray that on. It's a chlorine solution, so that will then in turn kill any of the germs that are there.
The introduction of a new Bahamian cleaning product in the middle of a pandemic represents a shift towards self-reliance. In other industries, there have been increases in local production, such as face masks and hand sanitizers. Traditionally, though, sectors like manufacturing and agriculture only make up a small portion of the nation's GDP.
It's very important to see the value in manufacturers because we are able to get the raw materials and the finished product without a lot of, the importation of finished goods and things like that. And, a lot of us can supply the entire Bahamas, so it's something that the focus needs to be on moving forward.
With many other companies closed, Blanco's 35 employees are hard at work producing all its other products. Its offices are closed to the public, but it is carrying out merchant deliveries. Its newest product will hit shelves in 2 weeks, and Knowles hopes it's a sign of good things to come.
We want to be able to make sure that we can grow going forward. As long as the demand increases, then we are able to increase things like our employment, property, deliveries, everything like that. And that just makes us a more rounded, well-rounded company and important to the local economy.
Reporting for Our News, I'm Jared Higgs.
All right, thanks, Jared. Still to come, what will sports look like post-COVID-19? Stay tuned. And finally tonight, a former Olympic medalist and Sports Hall of Famer discusses the future of sports after coronavirus. Marcellus Hall reports.
Well, today we talk with one of our sports legends, Frank Rutherford. For those of you who don't know, he is the first Bahamian to win a medal in the Olympics on the track. He's also our first World Championship medal winner. Frank taking a moment out to talk with us about a number of different issues, including next year's Olympic Games and what's ahead.
Let's take you back to when you stepped on the track way back when, in the 90s, and you're the Bahamian out there, and nobody has this expectation that we can get it done. This guy coming in from a small country, and you pop off this jump, and next thing you know, you're on the podium with a bronze medal performance. Take us back to that, and really how that opened the door, so to speak, because I think we've won a medal in every Olympic since then.
The prelude to that was, remember, Frank Rutherford was not a very, very, very celebrated or even known junior athlete. You understand what I'm saying? I never made a Carifta team. Not that I didn't place well enough to be on the team, because some of those Carifta trials I did finish third, and won a couple of them I finished second. In 1987, I won the country's first ever World Championship medal at the World Championships indoors in Indianapolis, the first of its kind. And so I think from that time, in all my previous NCAA titles I've won, the world knew exactly who I was, because from the time I hit college, University of Houston, I was always ranked, even as a collegiate, in the top 5 in the world, always. With the story of Mike Sands being our team manager and helping me to really focus in Barcelona, I was able to, pull off the first medal, winning the first Olympic medal for the Bahamas. And you said it right, and let's keep it right. It's not only Derwin Knowles, it was Sloan Cook, and I think that the other time that Derwin won a medal, he won with his other teammate. I think he was a Robinson or something like that. So it was 2 guys, and they did that under the Bahama Islands. That's prior to 73 independence. So Frank Rutherford won the country's first World Championship and Olympic medals in an independent Bahamas. As a country, we have to now grasp who we are as a people and celebrate our successes as a people.
And our thanks to Frank again for taking that moment out all the way in Houston. Meanwhile, I'm Marcellus Hall for our news. The weather is next.
Thank you for joining us for Our News tonight. On behalf of the entire team, I'm Kyle Joaquin. Remember, you can catch Our News on the go with the RevGo Play app. Have a good Wednesday evening, Bahamas.